90% of sickness and diseases are all directly related to a dirty colon, and 99.99% of adults have dirty colon. The adult colon is like an old pipe of our kitchen sink where waste and filth are accumulated. To get rid of these accumulated toxins and fecal matters that are stuck in our colon, we need to detoxify. Noble Life International brings you the safest and best natural cleansing product to effectively eliminate all the waste matter in your colon in a most convenient way at an affordable price. A perfect combination of soluble and insoluble dietary fibers for complete colon care.
Ayan. Welcome everyone, and good afternoon, good morning to everyone who is watching right now. No, thank you for being with us, especially this very special talk that we are going to have, and with our special speaker. No, I'm so excited because it's actually my first time of being with him, no, as a host, no, for his talk this afternoon. And you know what, no, I am we are always blessed pag eto eto na ang nagsasalita po, no? Laging meron tayong maraming nakukuha. And so this afternoon, no, before ko po i-introduce sa inyo ang speaker po natin, I would like to say hi and hello to our CEO and President, Ma'am Lila Bailon Makapinlak, and of course, to Sir Don, no, good afternoon po in Singapore. And of course, no, to the team Singapore, Sir Ernest, and to the team UAE, no, Sir Louis, and to the team Hong Kong. Now, of course, Adrian in Hong Kong, good afternoon sa inyo dyan. And also to Tito Tony, no, in Europe, of course, hello po sa inyo dyan. And to our Philippine branches, no, I'd like to recognize our from the headquarters, no, team from the headquarters headed by Ma'am Judy Pascual, of course, and Ma'am Jing there, and the rest of the team. No, good afternoon po sa inyong lahat. Good afternoon sa mga taga-dait natin na mga kasamahan, and to Dagupan, to Kalapan branch natin, and of course sa Ordaneta branch po natin, and Dagupan branch po natin, lumalaki ng lumalaki po ang ating family. And of course, I'd like to also say hi to Baguio team. No, they are very busy right now preparing our event in Baguio. We'd like to invite you all for this coming event in Baguio that we are going to have. No, so bablas po namin yan mamaya. All right, and so I'd like to also to say hi, hello to our team in Cebu, no, headed by Junel, and of course, Team Burungan in Samar, and of course, Kate in Tacloban. No, so talagang lumalawak from Visayas down to Mindanao po. No, our Mindanao team from Tagum, no, headed by Evany, and of course, Davao. No, so sa Team Davao, good afternoon po sa inyong lahat, and thank you for being with us right now, and thank you, no, of course, for being an instrument in sharing this wonderful talk that our speaker have prepared, no, for all of us this afternoon. And sana, no, hindi masasayang at yung lalo na yung panahon ninyo na ibinigay ninyo at shinare niyo sa amin, no, together with us. And of course, no, nire-remind lang po namin kayo na every Tuesday po, every Tuesday, meron po lagi tayong mga presentations na ganito. And so watch out for the next event, the next presentation na gagawin po natin next Tuesday. So to this afternoon, no, hindi ko na patatagalin. No, of course, our topic is epilepsy awareness. Ay grab, alam, ito talaga, Dok, I think this is one of the most neglected, parang para sa akin, no, hindi masyadong nabibigyan ng pansin talaga ito. Pero sobrang dami pong may epilepsy. And every time na umiikot ako, may mga nakikita akong basta na lang inaatake dyan. And so somehow, paano ba talaga natin matutulungan tong mga to? And paano ba natin i-deal ang mga ganitong situation? And paano ba natin ma-prevent ang mga ganitong situation po? So this afternoon, it will be cleared out by our speaker, because our speaker, I believe, this is one of his expertise, because our speaker this afternoon is a clinician, a neurotrauma surgeon, no? And of course, no, he is also practicing complementary and alternative medicine. So pag sinabi nating a doctor that has this degree, a very rare career, in life, but doing this complementary medicine, no, you know what? Grabe, sobrang hanga ako sa mga practitioners, sa mga doctors na talagang gumagamit ng or ginagawa nila yung complementation. And this is because they have the heart to help, and they have the heart to really reach and touch people's lives. So this afternoon, please help me welcome and listen to the presentation. No, without further ado, our speaker this afternoon is no other than Dr. Romeo Orteza, our medical director of Noble Life International. Doc?
Hi, Bong. So, good afternoon. Napakaganda naman ng introduction mo. Nakaka-touch naman. Parang nami-miss tuloy kita.
It's really true naman talaga, Doc.
Matagal na kami magkasama ni Bong, kaya alam namin ang isa't mga bituka namin kung anong kilos namin. So anyway, Bong, thank you for being a partner in this Health Talk. I appreciate it highly. Okay, so una sa lahat po ay gusto kong bumati, madali man lang, baka magtampo ating mga kakilala dyan. So, hi kay Madam Lilac sa Singapore and Sir Don, and Ernest in the staff in Singapore, kumusta kayo dyan? To our Dubai team, so kumusta dyan, Louie? And Pastor Don, baka nandiyan ka pa. And hello to Adrian in Hong Kong. And to our other branches in Europe po, and Europe team, Amsterdam, Croatia, Netherlands, especially Germany, headed by Tony and Vilma. Hello dyan. And to our Philippine branches po, marami tayong branches sa Pilipinas. So, from Baguio, Dagupan, Ordaneta, Pangasinan. And to our Daet Bicol team, headed by Pastora. And to our Doc June in Calapan, Mindoro po, kumusta kayo dyan? To our head office po, headed by Judy, the GM, Judy and Jing and the staff. So how are you? To our Visayas team in Cebu, and our Tacloban office in Samar, kumusta mo diya? And to our Mindanao po, headed by Doc Bong and Doc Nico. And Tagum po, kumusta ka mo diya sa Davao? And to our viewers po, right now, hello and good afternoon. Bong, can we start? Pwede na.
Yes, Doc. Go ahead.
Okay. Okay. So, ang topic natin ngayon po ay very timely. Sinabi nga ni Doc Bong, this condition is minsan highly dangerous at saka maraming complication that will arise. Nevertheless po ay medyan nawala ng importansya. Pero marami po tayong cases po, in fact sa Pilipinas, na mayroong epilepsy po. Alam mo, ang epilepsy po is usually present in children, at saka po siya ay mayroon din adolescents po na they occur for the first time at any age. Initially po, most cases po are children. So increasing incident po in the elderly. So hindi nyo alam po, ang epilepsy po is highly associated with brain tumor, at saka po ay may related sa trauma cases, kagaya ng stroke, brain tumors, and Alzheimer's disease po. Okay? So ano ba yung epilepsy? Alam mo, yung epilepsy po ay isang neurological condition. So pag sinabing neurological condition po, ay ang seizures po, it varies from wherever it is happening in your brain. So it might be beginning in the frontal, sometimes po it aggravates and leading to parental lobe, or minsan nasa temporal, papunta sa occipital lobe. So how far they spread po, ay the most seizures are lasting for 30 seconds to 2 minutes. So pag umabot naman ng 5 minutes po ay hindi magandang sign. So higit sa lahat po ay 10 minutes po is a dangerous moment of the patient suffering from epilepsy. Okay. A person with epilepsy will experience a seizure when the brain overactive electrical signals po misfire. So yun ang nakakatakot po kasi mayroong misfiring of the electrical impulses po or electrical current po sa brain. So ito ay nangyayari pag ang brain mo ay nagkaroon ng causes ng disruption ng normal activity, ay communication problems among nerve cells po ay being hampered. So may problema po sa distribution of electrical impulse po. Okay. Anyone can develop epilepsy for that matter. So anyone. So ibig sabihin po, maaaring sa bata, maaari pong sa matanda ay magkaroon ng epilepsy. So yun ang ating tatalakayin ngayong hapon ito. Most seizures po last a few seconds and few minutes. Can make a person or feel sleepy and confused. So medyo balisa at saka antukin for a period of maybe a few minutes o minsan man few seconds or few minutes po. Ang delikado kung longer ng 5 minutes po. Alam niyo po ang seizures mayroon jerking na tinatawag natin na fit o shaking. Ang iba naman ay shaking. Ang iba naman nakakaramdam ng like loss of awareness. So mayroon sila unusual sensations. So typically it will last for a few seconds or minutes. So sometimes other people suffering from seizures can experience awake. They're awake and sometimes they feel asleep. So sometimes they can be triggered by something such as feeling very tired. Kaya po hindi maganda ang sobrang kapaguran ng isang pasyente na mayroong sakit na epilepsy kasi po ay kadalasan po mag-trigger siya pag medyo pagod na pagod ang pasyente po. Okay? Some people may not remember the seizure and what happens immediately before. So may iba po ay nakakaalala, mayroon naman iba hindi nakakaalala po. So in others naman po, their awareness po is being altered. So medyo may problema sila sa alertness nila po. So having seizure does not necessarily mean that the person has epilepsy. So mayroon naman mga pasyente dyan na may seizure pero wala naman siyang epilepsy. So marami pong factors na magkaroon ka din ng seizure for that matter. Okay? If a person experiences one or many seizures for unclear reasons po, ay paulit-ulit po ay hindi magandang sinyalis po. Additional seizures, they may be diagnosed with epilepsy na kasi po ay mayroon ng predisposing factors. Ibig sabihin po ay tinatawag namin na stabilized seizures pero definitely po iba-ibang klaseng epilepsy po. A seizure that lasts more than 5 minutes is a medical emergency. So importante po pag lumagpas kayo ng o nakapeg sa 5 minutes or more ay hindi magandang signs. So kadalasan po ay ang loss of consciousness po ay unconsciousness ay medyo severe. So ibig sabihin damaging to the brain cells. However, other people's fully aware what's going on and they can't speak or move until the seizure is over. So pag natapos na lang, doon lang maalala o minsan naman iba ay hindi nakakaalala kung nagkaroon sila ng seizures. Epilepsy can be developed during childhood or later in life. So those who develop at a younger age po ay seizures may become less frequent. So eventually po it will go away depending on the case or type of the epilepsy. So, ngayon mamaya tatalakayin natin ano ba yung mga severe, ano naman yung mga mild epilepsy. So, potential causes of epilepsy, yung tinatawag namin na brain malformation. So, yung tinatawag natin na ABM. So, mayroon kang brain arteriovenous malformation. So, nag-entangle yung abnormal blood vessels mo sa brain. So, connecting arteries in the veins po ay may problema sa brain po. So, ang kadalasan po nangyayari, yung artery mo ay nagdadala ng oxygen po, rich blood, galing sa heart to the brain, o mayroong problema na pag-deliver ng oxygen sa brain po. Or pangalawa, lack of oxygen during or before delivery. So, na-delayed yung delivery ng baby, so nawalan ng oxygen sa brain ang bata. Low levels of blood sugar, so magkakaroon ka rin ng signs ng epilepsy or seizuring, o mababa yung iyong calcium, so nagtitrigger din siya, mababa ang magnesium or other electrolyte disturbances, inborn errors of metabolism, chemical disorders ay attributory din siya, or meron kang intracranial hemorrhage o may bleeding sa brain, and even taking maternal drug use, yung buntis ka pa ay nakaka-trigger sa epilepsy ng baby later on. Okay? Potential causes of epilepsy. So it might be tinatawag namin na congenital, so inborn. Yung tinatawag natin na Down syndrome. May tinatawag din tuberous sclerosis o neurofibromatosis. So naman yung mga Down syndrome, mga bata na pinanganak po na may extra copy of the 21 chromosome causes physical or mental development delayed and disability. Yun naman tinatawag na tuberous sclerosis po ay very rare naman siya. Subalit po ay nakakaroon ka ng tumor sa brain. So ang manifestation yan ay mayroon siyang seizure. Neurofibromatosis po is a genetic condition na siya po ay mayroong problema sa nervous system which affects the nerve cells po at saka the formation of the nerve cells pwedeng mapasa sa magulang papunta sa anak yung tinatawag na neurofibromatosis po. O meron din tinatawag na genetic factors, may primarily seizure disorders or head trauma, nagkaroon siya ng accident po. So potential causes of epilepsy po, it might also be caused in the elderly for stroke-related Alzheimer's disease or head trauma. So hindi lang po exempted ang mga bata, pati ang mga matatanda ay magkaroon din sila ng risk for getting epilepsy. Epilepsy po is not a mental illness po. In fact, the vast majority of people living with epilepsy po ay have no cognitive or physical manifestations for that matter po. So for the most part, psychological issues of epilepsy are limited to people with severe uncontrolled epilepsy. So ibig sabihin po niyan, you have some symptoms even after seizure activity in your brain has stopped. So kasi po ang nangyayari after the effects of the seizure po ay mayroong feeling of sleepiness, confusion, may certain movement or tinatawag namin na unable to move or difficulty talking or thinking normally. So, kaya po ay tapos na yung epilepsy, mayroong after effect po na nangyayari po. So, signs and symptoms, it might also be symptoms of the motor problem or sensory or psychic or even the autonomic nervous system for that matter. So, alam mo, maraming extensive research po na napatunayan na ang epilepsy po is highly aggravatory for stressed people and anxiety people. Can easily trigger the psychogenic, tinatawag namin psychic or sensory, psychogenic non-epileptic seizures or tawag niyan PNES, pseudo seizures po ang tawag niyan. So yan ang nangyayari po sa mga pasyente na naka-experience ng maaring stressful ang kanilang buhay or nagkaroon sila ng panic attack syndrome o nagkaroon sila ng anxiety for that matter or depression. Okay, motor signs. So mayroong altering contraction or relaxation of the muscle group. So mayroon siyang eye movement, mapapansin mo. Mayroon din turning of the head po in the same side or asymmetrical posturing of the limbs or speech arrest. So yun ang mga manifestation ng motor. Pag sinabi naman po ay sensory symptoms, mayroon kang makitang flashing of the lights or mga kulay or hearing, humming, or buzzing, or hissing sounds. So may mga muugong po na sounds. Experiencing unpleasant odors po, ay meron ka naamoy na unpleasant odors na maaaring wala naman dyan, or dizziness for that matter, or lightheadedness po. Medyo lutang ang iyong isip. So pag sinabi naman autonomic signs po and symptoms po, ay meron flashing of the lights again, meron naman tinatawag na nausea and vomiting, meron tinatawag na papillary, may tinatawag din tayong tachycardia or fast beat na naramdaman ang pasyente po. So yun po ang mga sinyalis na it might be autonomic signs of seizures. Okay. Mayroon naman psychic, dreamy state po. Ay mayroon daw silang sinasabi na parang malayo ang kanilang nilakad or mayroon silang nakalutang sa ere, mga kwento ganon. Mayroong memory distortion, so malang coordination sa sinasabi. Mayroon din sinasabi po na unprovoked emotions, mayroong fear or pleasant or displeasure or depression or anxiety for that matter. So medyo extensive na ang psychic symptoms po ng isang pasyente na mayroong experience ng seizures. So what are the types of seizures? Okay, seizures may look scary and unlookings, but persons do not feel the pain while having seizures. Kung kayo ay nakapaligid sa may seizures po, medyo kinakabahan ka kasi medyo uneasiness yung nakikita na gumagalaw ang pasyente na hindi niya naramdaman. So talagang wala silang naramdaman po. Pero tayo nakapaligid po ay mayroon tayong higit sa lahat ay may nararamdaman na uneasiness. It's really terrifying whether you're a person experiencing an aura and someone witnessing the grand mal seizures with convulsion. So nakakatakot po yung grand mal with convulsions po kasi mag-longer ang kanyang duration saka medyo malikot yung pasyente. So alam mo, during the seizures po, you lost consciousness, your muscles violently contract. So mayroong iba nga nakakabasag daw ng mga gamit sa bahay o sa office and your skin turns blue from lack of oxygen. So hindi magandang signs po niyan. Some patients of mine, they have a feeling of having certain experience of deja vu. So ang iba naman po ay mayroong silang parang nasa disyerto daw, naglalakad. So yung tinatawag na deja vu. So iba-iba po ang experience ng mga nagsi-seizures po. Okay. Epileptic seizures usually fall into one or two categories. It might be partial or generalized po. So partial, it might be also focal seizures. So specific siya. O temporary lang kasi partial. So partial seizures po starts in one part of the brain but abnormal activity will be moved to other parts of the brain. Ang problema ng partial po, it might travel to other parts of the brain. So maaaring frontal, pupunta sa occipital, so palipat-lipat siya po. Okay? So partial seizures may experience twitching throughout the body. So have slurred, abnormal, unusual speech. So ang iba naman, mayroong mumbling na sinasabi na hindi mo maintindihan. Or feel tingling throughout one side of the body. Mayroon na parang kuryente na nagtatraverse sa kanyang side ng iyang extremities o sa kanyang side ng kanyang pangatawan. So how a person experiences this all depends on what part of the brain had an abnormal electrical activity. So depende po kung saan tumama yung problema sa seizuring po. Okay. During the partial seizure, a person may or may not be aware of his surroundings or actions. Kadalasan po ng partial ay hindi na naramdaman ano yung nakapaligid. So kaya kami, pag naka-experience kami ng pasyente na nagsi-seizure po ay pagkatapos in-explain namin ano nangyari, anong ginawa niya para po medyo meron siyang idea po. Okay. Simple partial seizures po ay ang experience nila ay full awareness mentioned, rhythmic movement, so mayroon tinatawag na twitching, gumagalaw ang kanyang arms or face or legs, rhythmic movement, sensory symptoms, may tingling daw, weakness, sounds, smell, may naamoy sila na hindi maganda, or feeling upset stomach or visual distortion. Mayroon din tinatawag na psychic symptoms, deja vu, mayroon na unusual less than 1 minute, and may be confused with acting out mystical experience in psychosomatic illness po. Kasi po, may mga seizures that they do not lose consciousness. So, ito sila. So, minsan aware sila, naramdaman nila. Kasi partial. Although fully aware of what's going on, they can't speak or move. So, hindi sila nakapagsasalita until the seizure is over. So, yun lang masasabi nila na bago daw nag-seizure, ito naramdaman nila. So, kadalasan po, yan ay simple partial na seizures. Okay. Partial seizures have been categorized into two, simple partial and complex partial. So, ibig sabihin po ay mayroong simple partial, conscious siya, without loss of consciousness, confined to a single local of the brain, hindi naman siya nag-complex, so abnormal activity in one limb or muscle, so may weakness, autonomic symptoms po, nausea, blood pressure changes. So, yung complex po ay loss of consciousness. Pag nakakatakot po yung complex kasi minsan po ay lumilipat ng focal location ng kanyang seizures. Simple partial followed by loss of consciousness, impaired consciousness from the onset, inhibit complex sensory hallucination. So, parang nandun sila sa twilight zone daw. So, motor dysfunction may involve chewing movement. So, minsan, gumagalaw ang bibig, parang kumakain ng chewing gum. Pero actually, it's more on the psychosocial subconscious lang yan. Okay. Generalized seizures involve simultaneous abnormal electrical activities all over the brain. So, generalized yan. Okay. So, there are different types of generalized seizures. Absent seizures. So, mayroon din tinatawag na absent seizures. So, mayroon din tinatawag tayo na during the absent seizures, ay ang tao ay nakakaramdam ng staring of the space or daydreaming for 15 minutes after this type of seizures. So, parang nakatulala ang pasyente. So, sometimes ang tawag nito ay petit mal seizures kasi rapid blinking of the eyes or few seconds staring on the one space or one object at a time. So yun ang tinatawag na absent seizures po. The tonic-clonic seizures, ano naman to? Yung tonic po ay it's the grand mal seizures. So medyo po ay nakakatakot po kasi po ay naramdaman mo ang mga pasyente na ganito ay umiiyak at saka they lost consciousness. So they fall on the ground. Ang delikado ito pag hindi mo ma-anticipate yung pagbagsak, baka mabagok yung ulo po. So another problem will happen to the patient. So mayroon silang have muscle jerks at saka spasm po. Okay? So tonic-clonic seizures, a person's eye may roll back. So parang makita mo yung puti sa mata. So their muscles may stiffen, maninigas, and sudden jerking. So may twitching po and flinging their arms. So pumapalag yung kanyang mga kamay po. So kaya po nakakatakot yung tonic-clonic seizures po. Okay? So their body may be so limp, causing them to slumber down or fall over. So kaya po kinokontrol mo siya, huwag mo lang higpitan. So medyo hawakan lang ng konti po para po in control ka sa kanyang movement. Pero hindi pwede pigilin ng pigil na pigil po. So they may lose control of their bladder and bowel. Sometimes po ay nadudumi o naihi sila. So yun ang nakakatakot po sa tinatawag natin na grand mal seizures or tinatawag na chronic po or tonic seizures. So myoclonic seizures po, ito naman ang mga pasyente po na brief and shock-like jerk of the muscle. So shorter lang, parang mayroong kuryente na nag-traverse. So generally do not last for a few seconds po. So ang naramdaman nila po ay one side of their body po, symmetrical po ay mayroon daw jerking of the lips and twitching corners of the mouth. So gumagalaw. Tsaka mga jaw po ay turning movement po na uncontrollable. Sometimes this rhythmic jerks po of the head and legs may occur. So seizures last 10 to 60 seconds, typically occur daily po. So itong myoclonic po ay kadalasan po ay naka-experience sila usually po every day. So hindi maganda po yung myoclonic seizures po lalo. Sometimes a person will also experience a myoclonic seizures, but it's impossible that they may experience many in short period of time clustering. So iba naman po ay it varies from individual to individual. Minsan naman po ay mayroong period of time pero lumalayo ang interval po. Now, how can you tell if the person is having seizures? So importante po ay alam nyo kung ano ba yung tao na nagkaroon ng seizures. So if it can sometimes be difficult to tell if someone is having an epileptic seizures because everyone experiences seizures differently. Yun ang problema po pag iba-iba ang manifestation ng seizures po. Kasi iba-iba ang type ng seizures. Some people may experience convulsions throughout their entire body, while others po ay blankly staring po, nakatulala daw, nakatingin lang sa isang object na hindi naman nakikita nila yung anong tinitingnan nila for a few seconds yan. So there are certain stimuli that may trigger the seizures in someone with epilepsy. So dapat alam mo yung mga nagtitriggering factors po. So una ay, number one is lack of sleep. So proven yan po. Alam mo, yung seizures are very sensitive to sleep patterns po. So some people have their first tinatawag na seizures, pero nag-umpisa lang sa kulang sa tulog o balisa sa pagtulog na. So all-nighters, so yung mga hindi natutulog sa gabi, mga graveyard shift, so prone sila sa seizures at saka yung nag-aaral na nagka-cramming. And after not sleeping well after a long period, so you will experience seizure later on. So yun ang tinatawag po na kulang sa tulog, aggravatory for seizures and stress. Overstimulation, like staring of the screen, so nakatuto ka ng matagal sa may radiation, playing video games and too long. So in fact, maraming mga cases ngayon na work from home o walang trabaho, so nakatutok sila sa kanilang cellphone na hindi naman lighted, so masyadong madilim, so nagtitrigger din later on na seizure. So the neurologist found out na yung pala ay overexposure of the radiation. So mayroon din fever and illness po, it will also aggravate the seizure as well. Okay. Certain medications, so check your pharmacist kasi may mga medications po that can aggravate seizures. At saka yung mga hilig uminom na alcohol and some illegal drugs are aggravatory for more seizures sila. What should you do if the person as a seizure. Ano natin dapat gawin kung ikaw ay naka-experience ng pasyente na may seizures? So, it can be scary po for that matter, especially kung first time ka nakakita na nagsi-seizure. So, someone have a seizure and there are few things you can do to keep that person safe. So, may mga paraan upang tulungan mo yung pasyente, huwag mong iwanan po kasi later on you will feel guilty na iniwanan mo siya. Kasi dapat ay alam mo naman anong maitutulong mo na madali naman maitutulong po. Okay, stay calm. Do not hold. Huwag mong i-restrain yung pasyente. Pag pumapalag po, huwag mong pigilin ng pigil na pigil po. Alalay lang. Help the person lie down on their side, nakatagilid, in flat. A flat, comfortable surface. So, dapat daw ay comfortable surface. Hindi po rough yung hinigaan ng pasyente. At saka dahan-dahan po, binababa ang kanyang ulo at saka katawan at saka nilalagay sa magandang komportable na higaan po or maski sahig na medyo comfortable naman, hindi naman rough. Okay? Do not put anything on the person's mouth during the seizure. Ang iba kasi ay nagsisisure na nilalagay ng kutsara o tinidor o something na may tuwalya. Hindi po pwedeng ganun kasi nag-attack na siya eh. Enforcing the mouth to open, never open the mouth of a patient or suffering from seizure po. It will add more injuries po. Yun ang dapat yung gawin. So if the person is wearing glasses po or backpack, tanggalin nyo po. So anumang nakasagabal dyan sa kanya, ay tinatanggal yan. You should also loosen the tightness of the clothing. So luwagan ang mga belt o mga damit po, luwagan ang mga butones ng konti. At saka para makahinga ng mabuti po, lalo na sa leeg, ay dapat po ay maluwag. Okay? Move sharp and hard objects away from the person. Do not leave the person alone. So, importante, wag niyong iwanan po yung pasyente po. Dapat alalayan niyo po hanggang matapos ang kanyang attack po ng seizures. Make sure they are breathing without difficulty. So, tingnan mo kung humihinga. Baka binabantayan mo, hindi na pala humihinga. So, kailangan may gagawin kang ibang magandang hakbang po. So, talk to them with calmness, reassuring voice after the seizure is over. So, pagkatapos po, medyo tolero sila, balisa. So, kailan po kausapin mo ng masinsinan o mahinhin po na explain mo ano nangyari, anong ginawa nyo. So, para magkaroon siya ng peace of mind po. Yun ang importante. Talk to them after. So, pay attention during the seizure so that you will be able to describe what happened before and during after po. So, tandaan natin po, may mga seizures po, hindi nila alam ano nangyayari. So, it's your part na ma-describe mo sa kanila ano nangyayari kasi eventually po, pag nag-explain na sila sa kanilang neurologist po, ay madali na masangguni kung ano talaga ang dapat nilang gawin ng doktor sa ganitong klaseng seizure po. Okay. Ito yung mga signs na very common sa seizures. So, may tinatawag tayong confusion. So, may tinatawag din tayong aura, may flashing of the lights, di ba? Mayroon din tinatawag na sudden fall, bumagsak. So, yun ang nakakatakot. Or staring na tulala. Pag hindi nagsasalita po, natutulala, baka po ay magkaroon na siya ng impending seizures for that matter. Uncontrollable jerking of movement, strange sensations or emotions, and loss of consciousness and awareness po. Alam mo yung seizures po ay merong tatlong phases po na tinatawag. So may tinatawag kaming beginning, prodrome, and aura. So mayroon din tinatawag na middle, o ectal or post-ectal stage. So kaya po mayroong bago mag-seizure ay may tinatawag kaming prodrome or beginning. So medyo maramdaman mo na ito na nagsa-science na magmamanifest ng tinatawag na ectal or middle seizure para maka-prepared ka for a post-ectal stage para hindi po madadamage yung brain ng pasyente po. Okay. Medical attention is very needed in this matter, especially trouble breathing, appear bluish. So makita mo siya, nagbo-blue na yung kanyang labi, yung kanyang bibig, or after the seizure po ay nalaman mo mayroong diabetes po, yung pala ay hindi pala cause ng epilepsy, yung pala ay masyadong nagkaroon siya ng pagbaba ng sugar po. So delikado yan baka kasi pag umulit yan baka magkaroon ng coma yung pasyente. So dapat po ay maramdaman ng pasyente na normal ba yung kanyang sugar o sobrang baba. Yung kanyang medication ay hindi naman tugma doon sa kanyang diabetes po, masyadong matapang o sobrang mataas yung dosage po. Okay. These are the tools that we use for a person na suspect for a epileptic or seizure for that matter. So, MRI, kailangan yan, or EEG, electroencephalogram, CT scan, and blood test po. So, importante sa lahat, una-una po yung electroencephalogram or EEG po. Kasi po, yung epilepsy po ay cause difficulty in being able to store memories sa mga pasyente. So, importante talaga ang brain. So, ako, ang tanungin mo ko, I go first for all, EEG, electroencephalogram. So, maraming pag-aaral po na mga epileptic po ay na-ignore ng pag-test ng EEG, sila ay prone, predisposing for a rapid progression of memory lapses later on. So, importante yan po na dadaan sa EEG muna. So, this is the most common test for a diagnostic of epilepsy. In this test, electrodes are attached to the scalp. So, paste-like substance of the cup. So, mayroong cup siya para ma-stabilize siya. The electrode ring record the electroactivity of the brain. So, may maraman mo ano aktibidad ng brain niya, kung may anong klaseng epilepsy for that matter. So, ito ang mga binibigay ng unang-unang signs ng epileptic. So, ABC muna, titingnan mo, is the patient airways normal, breathing and circulation. So, bibigyan din ng diazepam. So, i-repeat mo yung 15 to 30 minutes. Pinitoin po, 10 to 20 milligrams per kilograms o penobarbitals, 5 to 20 milligrams per kilograms. So, yun na ang binibigay ng doktor po. So, pag severe naman po ay we intend to do anti-epileptic injectable or anticonvulsant drug. So, combination of pinitoin, delantin, and dipil hydantoin. So, combination siya. So, alam mo yung epileptic po ay higit sa lahat po, they often neglect or ignore during the dental management. So, nakakatakot po. Marami pong nangyayari sa pasyente during the time that they visit their dentist po. Forever, whatever they do, extractions or peeling of the mga butas ng mga ipin or ano pa bang ibang gagawin mo sa dental procedural. So, importante po sa dental po ay ang kanyang chair ay nakasupine position. Kasi yung mga ibang dentist po, they are not aware na yung kanyang pasyente ay epileptic. So pag hindi mo sa isupine, kadalasan po mag-attack yung pasyente, magsi-seizure. Kung during the extraction of the tooth, baka naman po ay, nag-inject ka ng anesthesia, so delikado po ang mangyayari sa pasyente. So ensure proper dental lighting, so maliwanag, so wag lang itutok ang ilaw sa mata. Kasi pag itutok mo, magsi-seizure din ang pasyente. So take a complete health history, list medication patient is taking, oral hygiene, provide oral hygiene, instruction, and ensure healthy periodontal tissue and health and teeth po. So, importante yan. So, ensure medication have been taken properly prior to the appointment of your dental. So, minimize the risk of seizure. Perform proper periodontal and surgical treatment, gingival hyperplasia. So, minimize damage of the teeth and supportive structures. To maintain proper aesthetic, so importante and hygiene. Treatment plan and design restoration of minimize the risk of damaging and displacing dental restoration during epileptic seizures. Alam mo po, pag hindi careful ka, yung mga nilalagay mo na ano diyan, mga pasta or whatever, yung mga tinatawag na artificial tooth, so minsan po ay nadidislodge. So minsan ang mga pasyente po nalululod nila during the attack of the epileptic seizures po. So nakakatakot yan. Dapat permanent yan. Okay? So, how healthy is your brain? So, let me ask you. But just like any other organ in the body, it needs the right fuel and maintenance to function well. So, it has the right peak in continuous running of high performance level, not just for a short period of time, but all the time for the rest of your life. So, oftentimes po, nakakaligtaan yung brain. So, minsan, medyo conscious ka sa physical na anyo mo, yung physical, physique mo, yung body mo, pero all the time you often neglect your brain, which is very important. Kaya nga nilagay ni Lord sa ibabaw yan to very superior to all the other organs po. Okay. The company po offers you 3 simple steps. We detoxify you, we rebalance you, and give you cell nutrients po. So una, cleansing. So importante sa cleansing po, pag ikaw ay mayroong epileptic o mayroong history ng epilepsy. Kasi po, kadalasan po ay mga maraming heavy metals or toxin sa body or mga unstable elements or molecules dyan na predisposing factors for triggering of the epilepsy sa brain po. So, mayroon tayong, sa ating cleansing, mayroong soluble at saka insoluble fibers po. So it doesn't only cleanse your colon and helps your organs function well, so it also brings your pH level, the potentiation of hydrogen into alkalinity po. So nearest to alkalinity. So importante yan po. So chlorophyll naman, alam naman natin po, powerful blood cleanser yan. So cleaning yung inside out. So marami siyang tulong sa mga pasyente po na merong epilepsy or especially po nagsi-seizures. So number 2, you also give cell nutrients po in repairing the damage of the neurons later on. So ito siya ay cell food. So complete food siya. Hindi lang siya ay food. Sabi nila it's also a healing food. So it's a food of the 21st century po. So 21st century na ay 15 years na inobol at napatunayan na talaga natin na proven na yung crypto po as a healing food. Okay. Ano ba yung mga benepisyo pag pinag-usapan po na mayroong seizure or may epileptic yung pasyente? Importante po yung B6. Kasi po ang B6 po is highly needed for oxygen-carrying hemoglobin. So a lot of medical study confirm that B6 po ay ward off depression and cognitive problems as well, whereby helping you think clearly. So kadalasan po ng pasyente na may ng seizure po ay medyo na meron silang mental declination or tinatawag namin na brain fog for that matter. So B12 also is needed for a patient who suffering from seizure or epileptic person. So clinical study then has been proven that B12 deficiency can lead to numerous brain and nervous system related diseases po. So even strokes and Alzheimer's and Parkinson, kadalasan din po ay may pagkukulang ng B12. So B12 deficiency can lead to a brain shrinkage as well. So magkaroon ka ng brain plaque kasi po ay mag-shrink na yung brain mo. Kasi po nag-umpisa lang pala sa deficiency ng B12. So proven na yung B12 can fight memory problems, anxiety, and panic attack syndrome for that matter. Okay, folic acid din po ay needed kasi proven siya to boost the brain power and memory enhancer po. And folic acid improves brain processing speed up. So, alam natin, pag mababa hemoglobin hematocrit mo, you need the iron and the folic acid kasi minsan magkaroon ka ng brain fog din. Aside from its proven folic acid has the ability to fight diseases such as cardiovascular and cerebrovascular diseases po. It's also good for the cardioprotector and cerebroprotector as well. So, zinc din ay kailangan din natin yan. So, ito sila lahat ay binabanggit ko ay nandun din sa crypto. So, essential for growth, immune functions, and wound healing, production of hormones, and unlocking the hormonal imbalance po, nervous system, and the brain functions as well. So, importante din yung zinc. Lalo sa mga kalalakihan po, importante yung zinc. Kasi pag kulang ka ng zinc po, ay candidate din tayo ng benign prostatic hyperplasia. Okay, folic acid, B1 and B12, B6, has been proven associated with neurological and psychological dysfunction. So, in the elderly daw, increasing concerns, satiety, atrophy, gastritis, decreased function of olfactory functions po, may sensitivity ng kanilang gut o pampanunaw, at saka mayroong wala na yung disposition, di ba? Medyan wala nang control sa kanilang mindset or olfactory functions and responsive mechanism. So sila ay magkukulang ng folate pala, folic at saka B1 at saka B6. Increasing homocysteine has the direct correlation with deficiency, and this deficiency is needed po. Importante kasi pag hindi mo na-stabilize yung homocysteine po, ay siyempre ang pasyente din high risk for getting heart attack. Okay. So, cellular nutrition in the crypto helps the central nervous system require a number of amino acid. Yung kagaya ng tryptophan, alleviate insomnia and depression, anxiety, tyrosine, ay nakakatulong din sa chemical messenger and mental alertness, and studying and potent in neurotransmitters. So, importante din yung mga amino acid po na protein kasi kailangan natin essential at saka non-essential amino acids. Arginine din, body changes, kasi nitric oxide po ay it helps the blood vessels dilate, improving circulatory. So, mag-improve yung blood flow. So, they are used by the brain for synthesis of various neurotransmitters and neuromodulatory functions and problems po, especially yung arginine. So, essential amino acid, phenylalanine po ay building blocks ng protein which also helps reduce the plaque deposits kasi pag hindi mo na-increase yung amino acid essential phenylalanine po ay candidate ka for tinatawag natin na Alzheimer's disease po kasi magkaroon ng plaque deposits sa brain. Okay. So how are the PPARs plus helping the patients from suffering from seizures or epileptic for that matter? So may malaking tulong po yung PPAR plus po, a combination of the resveratrol and the PPAR agonist po. Okay. The National Research Institute and Institute of Technology, Science sa Taiwan po, a Medical Research Institute po, headed by Shanti Wang, I found out that the PPAR plus or resveratrol and the PPARs has anti-inflammatory property for cardio and cerebral protector. So hindi lang siya maganda po na tulong sa ating brain, nakakatulong din sa vital organs, especially our heart po. Okay. Prevent damage of the membrane caused by the free radicals. So these free radicals po are unstable molecules. So alam naman natin, yung lifestyle natin po ay mayroong kakibat ng mga free radicals kagaya sa food natin, sa pollution, sa mga related sa oxidative stress. So unstable molecules siya po. The PPAR plus po has a high antioxidant po, stabilize the cascading of the free radicals po. Malaking tulong yan sa brain. So, triterpenoids po has diverse pharmacological activities such as memory lapses, cognitive declination, so antidepressant, neuroprotector, and other CNS actions. So, ibig sabihin, itong mabisang produkto nito na PPAR plus po is the ultimate supplement that is intended for our brain. So, kasi mayroon siyang triterpenoids po. Ano ba yung triterpenoids? So it's mostly this triterpenoids po, triterpenes po, tinatawag namin na triterpenes po ay o triterpenoids po ay abundant sa plant-based. So algae, lalo na itong ating product algae, so very abundant siya. It has a biological activity. So a wide range of biological activity from the immunomodulatory, anti-cancer siya, anti-inflammatory siya, anti-anxiety, antidepressant siya, memory enhancer, neuroprotector, and other CNS actions. So marami siyang demonstrable, specific against transcriptor factors na nagtitrigger ng iyong condition, kagaya ng iyong seizuring or yung epileptic na condition ng pasyente. So ibig sabihin po, it has a protein involving in the process of the what they call converting the transcriptor factors into RNA. So yung DNA mo ay tinatranscribe niya into RNA. So, gene control. Ibig sabihin po, napapansin mo, pag nag-PPAR plus ka, especially if you're suffering from seizures, ay malilesin yung pag-attack ng seizures po, for that matter. So, PPAR or peroxisome proliferator activator receptor cells is a family of receptors, meron sa alpha, beta, gamma receptors, has been successfully tested for neuroprotector potentials in central nervous system. Especially also, it's also beneficial for stroke and Alzheimer's disease patients as well. So PPAR alpha is regarded as an important role in the treatment of preventive of epileptogenesis. Alam mo yung epileptogenesis po ay yung mga pasyente po na hindi responsive yung mga medication na iniinom nila. So magkaroon sila ng epileptogenesis po, yung tinatawag na refractory epilepsy po or tinatawag na intractable epilepsy po. So, meron silang, what do you call this, hindi na tumatalab yung kanilang medication po, the more sila nagsisisure. So, very effective yung PPAR plus sa mga ganong condition po na tinatawag namin na refractory epilepsy po. Okay. PPAR alpha has expressed in many brain regions which play an important role in refractory epilepsy. So, napatunayan po, yung PPAR alpha is very present sa lahat po ng part ng yung brain. So, they found out also in a person na nagkaroon ng epilepsy po, tinest nila yung brain waves po, ay nagkukulang na ng PPAR agonist alpha. Kaya po, the more nagtitrigger siya ng triggering epilepsy or tinatawag na seizuring effect. So, ibig sabihin, yung PPAR natin na alpha na nandun sa PPAR plus ay nakakatulong pag-alleviate ng mga persons suffering from epilepsy refractory. So, the potential mechanism ng alpha, clinically proven, modulating the neurological transmitter of the gene expression, reducing the neuroinflammation activity, inhibiting the neuronal oxidative stress, So para hindi mag-trigger ng seizuring, improvement of neuronal fatty acid oxidation. So they were able to recall what happened during the attack, whereby lessening the epileptic episodes as well. So pag na-achieve mo yung lahat sila, ay definitely po, bottom line, you were able to lessen the epileptic episodes as well. So in fact, with my experience po, marami akong pasyente din sa ating office na mayroong epilepsy po, di na gano'n sila nag-attack, especially may ABM ako na pasyente na suffering from supposed to be magsi-seizure, hindi siya nagsi-seizure po because of taking the PPAR plus po. Okay. Lastly po, the PPAR activity from the PPAR plus promotes CNS repair and functioning of the for recovering faster. So activation of the PPAR minimizes cell death and reducing mitochondrial dysfunction. So malaking tulong po sa mga pasyente po na mayroong epilepsy or seizure for that matter na maibsan yung kanilang naramdaman po na seizuring po. So balit po, honest to goodness po, I'll tell you the truth, wala namang specific na gamot yung epilepsy na suffering from seizures po. So we only alleviate and control the severe condition na by controlling the severe na malesen siya, it will lessen the damaging of the brain cells po. So kasi pag totally palagi nagsisira ang pasyente po ay delikado ang katayuan ng pasyente. Pero with my experience po ay nababawasan ang kanilang seizuring at saka they live a normal life as well. Okay, thank you and God bless. So, huwag niyong kalimutan po, Noble Life cares for you. Doc Bong?
Yes, Doc Ol, maraming salamat po, no. Napaka-informative and sobra na-appreciate ko yung Doc, no, yung information ba na although walang treatment na para talaga sa epilepsy, but somehow if we give the nutrients that our brain needs, especially this fatty acid, this B complex, no, the vitamin B9, 6 and 12, which is very important. Wow. Which is nasa crypto lang, no, and of course yung yung mga amino acid na kailangan that to activates and regulates the neurotransmitters, and it is very important na talagang nakakatulong in a way na ma-regulate natin yung attack. So from the raw material itself of PPARs, which is the cryptomonadales, and going to the PPARs itself, no, Doc, grabe, yeah. Sobrang mas nag-i-empower talaga. Yung Doc, yung narinig ko po sa inyo kanina na it will help the condition, lalo na pag hindi na responsive yung pasyente sa mga may mga complications na it's really good to take PPARs para magkaroon ng responsiveness at mag-develop.
Yes, tama ka, Doc.
Mabalik yung so, yeah, it's very important, Doc, talaga na to have this opportunity, no, for everyone to really know and understand about how we could be able to address properly. Kasi yun nga, Doc, no, yung problema talaga na pag inatake na yung pasyente, talagang magpapanik yung yung mga.
Kasi iniiwanan, nakala ano na yun.
Oo, tapos iwanan, akala nila na nabaliw yung tao. Yung pala inatake, and somehow actually may namatay ako na friend talaga, Doc. Kaya ako medyo excited to know more, to know deep about epilepsy. Kasi may namatay ako na kaibigan, Doc, na ano lang siya, bigla siyang natumba.
Nabagok.
And nabagok siya and na-choke na siya kasi nakahiga ng
dapat nakatagilid.
Nakatihaya. Dapat nakatagilid kasi kasi bigla nag-ano sila. So na-choke siya sa kanyang so that caused him na talagang namatay, no? So it's really actually a critical critical thing na kung hindi natin alam kung anong gagawin,
tama,
baka pwedeng ma-damage talaga. And somehow ang ganda, no? Ang ganda talaga, Doc, na may hope lahat ng mga
Yes.
may epilepsy, no? Hindi lang pala very common kasi yung bumubula, yung naglalabas ng
Bibig,
ano, pero hindi lang pala yun ang ano ng epilepsy. Of course, yung iba
iba-iba.
na oo, nakatingala lang or
Parang
nakatulala lang siya.
tulala.
It's already an epileptic attack na pala.
Oo,
No, so
totoo.
at least somehow na-address right away. Kasi kawawa no, pag atake ng atake, no, it's the brain that will what? That will be damaged. Wow. So grabe, sobrang ganda ng ano natin this afternoon, Doc. And somehow I believe na marami ang natutuwa po sa ating presentation this afternoon. Yes, talagang totoong nakakatulong tayo, Doc. All right. So, any final words, Doc, para sa ating mga nanonood?
So, alam mo, do not be, huwag kayong masyadong kabahan kung mayroon kayong pamilya o kamag-anak o kakilala may epilepsy kasi pwede naman gawa ng paraan po. So, honest to goodness po, there is no cure for epilepsy but early treatment po can make the big difference. So, the PPAR agonist po can lessen and shorten the seizure attack. I promise you. So, highly beneficial in refractory epilepsy. So, alam mo, yung PPAR agonist po ay mayroon siyang property na interrupts the loop or tinatawag na progression of undergoing pathological changes sa epileptic individual. So, the PPAR receptors gamma regulates the gene inflammation, antioxidant and anti-inflammatory property whereby helping the mitochondrial pathways. So, mapapansin mo ay yung impact ng seizuring ay magle-lessen po. It will lessen and shorten the seizure attack by taking the PPAR plus po. So, if you know somebody o kayo man mismo ay mayroong nag-experience ng seizuring or epileptic conditions po, feel free to call us or get in touch with us. So we are here to help you po addressing your condition po and alleviating your condition as well. Okay, thank you for listening and God bless to all. Bye-bye. Bong?
Yes.
Thank you.
Thank you, Doc Orteza. And of course, no, I'd like to invite everyone to our TGIF this May 15. Of course, it's actually celebrating our 15 years of noble deeds. Join us on May 15 and experience surprises and prizes, etc. No? So join us this May 15. That's 5 p.m. And of course, no, we are inviting you to our Baguio event that is Gala Night and Zumba at in Baguio City. Now, of course, that would be this May 21. And there are actually prizes and raffle prizes no, na ma-avail natin. And we will enjoy and we will be actually, we are actually excited about the unmasking of the of the noble life body, no? So you know what, tingnan natin or join us with this wonderful event that we're going to have in Cebu City, no? So our team from headquarters will be joining with our team team Baguio, all right? And so that would be on May 21 po, no? So see you all there, no? And I hope that this afternoon's talk with Dr. Romeo Orteza is another wonderful experience for all of us. And so in Noble Life po, for 15 years of doing noble deeds, Noble Life International always care for you naturally. Thank you.